Hi, my name is Yusoff from Institut Jantung Negara. This is a VR reconstruction of a patient with repaired Tetralogy of Fallot using MRI 3D non-contrast angiography dataset. We start with cross-sectional axial slicing cranio-caudally. We note the RVOT is almost tubular in shape. The RPA is unobstructed while the LPA kinks at its takeoff position from the MPA. Slight signal dephasing of the proximal LPA suggests increased flow velocity or mild stenosis. The LCA is not assessed in this study. We then slice sagittally from left to right and change the windowing to vessels hollow. We measure the pulmonary valve annulus, distal MPA and RVOT. Due to arrhythmia originating from the RVOT, we are considering the anatomical suitability for transcatheter pulmonary valve replacement. We select the suitable venous P-valve model and simulate its placement at the pulmonary valve level, distal level, and proximal level. This was shown during our complex case discussion. This patient would benefit from a device with a shorter profile to avoid the RVOT. We decided against transcatheter pulmonary valve implantation this time around, as we only have access to devices with a long profile, and opted for surgical pulmonary valve replacement this time.